Hi, I'm Rebecca Buck, a licensed Minnesota Medicare broker. I have always worked alongside of seniors in one form or another. My first job was working in a local nursing home doing dishes in the kitchen. I then took an evening class while in high school to become a nursing assistant. I worked as a nursing assistant all the way through college. I went to college to be an accountant, but after working 1 year as an accountant, I was unhappy with sitting behind the desk by myself all day. But then I came across this role, which was my favorite part of being a nursing assistant, being able to help people and talk with them through something that they needed. And that's why I do what I do today. I love talking with people, teaching them about Medicare, and helping them through the Medicare process. In this presentation, we will discuss who is eligible for Medicare, the different parts of Medicare, and much more. Please, if you have any questions, feel free to call, text, or email me, and I would be more than happy to help with any questions you have. So let's buckle up and dive on in. What is Medicare and who is eligible for it? Well, Medicare is a federal insurance program for people 65 or older, people under 65 with disabilities, end-stage renal disease, or Lou Gehrig's disease. As I'm sure most of you know, Medicare is divided up into many different parts, like Part A, B, C, and D. And you might be wondering, what do they all mean and why some people call it the Medicare alphabet soup? Well, Medicare Parts A and B is what we call Original Medicare. You would get Medicare Parts A and B through Social Security. Then, any other parts of Medicare are add-ons from private Medicare companies to go on top of your Medicare A and B. As we go through this presentation, you will see why you would want to put a plan on top of just Original Medicare. Medicare Part A is normally $0 as long as you've worked 40 quarters or 10 years. Medicare Part A covers inpatient hospital, skilled nursing, home health, and hospice, but only up to a certain extent. So if you were admitted into the hospital, days 1 through 60 would be a $1,676 deductible for each benefit period, with a 60-day elimination period. But then, days 61 through 90 would be a $419 copay per day. You would get a one-time 60 lifetime reserve days for $838 copay per day. But anything above and beyond that, you would pay all costs with no max out of pocket. Again, this is a perfect example of why you would want to put a private plan on top of your Medicare A and B to give yourself a max out of pocket so you don't go bankrupt. Medicare Part A also covers skilled nursing as long as you stayed 3 overnights in a hospital first to qualify. Days 1 through 20 is a $0 copay, and days 21 through 100 would be a $209.50 copay per day. But above and beyond that, you would pay all costs. Medicare plans generally don't cover anything over 100 days. That would be more like a long-term care policy that would give you a more extended coverage in a care facility. Medicare Part A also does cover some home health care for $0 copay. It's generally for someone with physical therapy or is homebound and unable to take themselves into the clinic. It has to be approved by a doctor and be deemed medically necessary. Again, this is only part-time or intermediate. It does not cover long-term care. Hospice is also covered under Part A. It's generally a $0 copay, and you would get your doctors and nurses through hospice. And at this time, you would no longer need Part B coverage. Medicare Part B is usually $185 a month for the average American in 2025, but depending on your income, you could pay more or less. Part B covers your doctor visits, labs, tests, procedures, same-day surgery, hospital observation, mental health, ambulance, air or ground, medical equipment such as walker, blood sugar monitor, CPAP, etc. But it does need to be deemed medically necessary in order for Medicare to cover these things. Medicare Part B would have an annual deductible of $257 with an 80-20 split. Medicare pays 80%, you would pay 20%, with no max out of pocket. Part B also covers preventatives. As I said, Medicare Part B covers preventatives. Everyone will get this book in the mail after you sign up for Medicare. Medicare and you. This is a great resource for you to look up preventatives that are covered by Medicare. Anything in this book that you see a blue apple next to is a preventative and is covered 100% by Medicare. Side note, one of the silly things that isn't a preventative on Medicare is an annual physical. So depending on the plan you choose to go on top of your Medicare A and B, you may not have an annual physical covered. You can also get this book in an app. The app is called What's Covered. The nice thing about this app is that it has a nice search tool, so it might be a little faster in finding the things you may be looking for. In the previous slide, I said depending on your income, you may pay more or less for your Medicare Part B. The reason for that is Social Security uses IRMA, an income-related monthly adjustment amount, where the more you make, the more you may pay. For example, if you are someone filing individually and make $106,000 or less, you will pay the $185. Or if you're filing jointly and make $212,000 or less, you will pay the $185 as well. But if you look at the chart on the screen, you will see the more you make, the more you could pay for your Medicare Part B. But that's not all. IRMA also goes off your income of 2 years prior. So in 2025, they are looking at what you made in 2023. And that is the amount you would want to compare to this chart. We also like for people to be aware of is what happens if you are retiring with a big lump sum or a pension. Well, depending on when you took that lump sum or pension, you could be paying more because of it. Also, if you have a traditional IRA and you convert it over to a Roth IRA, that becomes a taxable event. And depending on how much and when that event took place, you could pay more because of it as well. Medicare Part B does also have a late enrollment penalty of 10% every year you went without either Medicare or credible coverage past the age of 65 or when you became eligible for Medicare. So I have an example over here of a friend, Joe. Joe retired at age 64. He realized he wanted to sign up for Medicare at age 68. He had to wait until the enrollment period in January. So our friend Joe went 3 years without Medicare or credible coverage. With his Part B being 185, he would have to take that times 10, giving us a yearly penalty of $18.50. Well, now we take the $18.50 and times that by the 3 years he went without coverage. So now our friend Joe has a $55.50 monthly penalty. This penalty will increase over time. For example, every time Medicare raises the Part B premium, his penalty will also rise. And again, this penalty is lifelong and will never go away as long as he has Medicare Part B. We are going to skip ahead into Medicare Part D. Medicare Part D is your drug prescription coverage. I always think of it as D for drugs. Private insurance companies run drug plans. Drug plans are determined by formulary, tiers, networks, and copays. A good thing that happened with Medicare Part D plan was in 2025 with the Inflation Reduction Act. They put a yearly cap of $2,000 on medication, whereas in 2024 there was an $8,000 cap on medications. And like Part B, Part D also has IRMA, an income-related monthly adjustment amount. If you are someone filing individually and making $106,000 or less, you will just pay your plan premium for your Part D. And if you are someone filing jointly making $212,000 or less, you will pay your plan premium. But if you look at our chart again, the more you make, the more you could pay for your Part D plan. And also, like Part B, it goes off your income of 2 years prior. So in 2025, you would want to look at what you're making in 2023 to compare to the chart. And also, like Part B, Part D also has a penalty. Part D's penalty is 1% every month you went without credible drug coverage plan past the age of 65. So, for the penalty, they look at the average drug plan price for 2025, which is $36.78. You times that by the 1%, and if you round that up, it's about 37 cents a monthly penalty. So if you look at our friend Joe again, who retired when he was 64, but didn't get credible drug plan until past the age of 68, who went 3 years and 2 months without a credible drug plan, which is 38 months. Now we're going to take that 38 months, times it by the 36 cents, 37 cents. That's going to give him a penalty of $13.98 a month. And that's going to be on top of that $55.50 penalty from Part B as well. And unlike Part B, this will increase over time. It will be lifelong. And all I have to say is please don't be like our friend Joe here and take the right steps at the right time to avoid any penalties. If you are someone with a low income, I recommend reaching out to your local county. There are multiple different programs that you could apply to. Some of the different programs could help you pay for your Part B premium, can help you pay for your medications, or apply for medical assistance. They all start when your assets are under $10,000 for a single person or $18,000 for a couple. This includes all money in bank accounts and retirement account, but they do not count one house or one vehicle. There are 3 different plan options: Medicare Part C, also known as Medicare Advantage, a Medicare Supplement Plan, also known as Medigap, or a cost plan. Cost plans are being phased out, and they are only offered in a select few counties. The counties that are around our current locations are Goodhue and Rice County. Let's start off by looking at Medicare Part C, or also known as Medicare Advantage. Medicare Advantage takes your Medicare Parts A, B, and D, your drug prescription plan, and it combines it all in one. Advantage plans are offered by private insurance companies that are contracted by the federal government but vary by the county you live in. Advantage plans have networks, copays, a max out-of-pocket limit, and may include some additional benefits like dental, gym, hearing, vision, and an annual physical. Inside of the plan can change each year on an Advantage plan. The second option is Medicare supplements, also known as Medigaps. They are more comprehensive and are standardized in the state of Minnesota. There are 4 main options for supplements in the state of Minnesota: the basic plan, the copay plan, the extended basic, and the high deductible. You may hear some people refer to supplements with other letters such as G or N, but usually in the state of Minnesota, we don't refer to them by letters. Medicare supplements are state-run and have an underwriting guidelines, which means you may have to take a health questionnaire in order to be qualified. But in your first 6 months of being on Part B, you are auto-qualified into a supplement with no underwriting. So if you try to sign up for a supplement 6 months outside of being on Part B, you would have to take a health questionnaire. They could pull your medical records and they could deny you. The nice thing about supplements is you can go anywhere Medicare is accepted, so there is no networks. You usually can keep your plan when moving. Your drug plan would be separate, and the inside of this plan really doesn't change. The third option is a Medicare cost plan. Medicare cost plans are a unique type of Medicare Advantage plan. I look at them as a hybrid between an Advantage plan and a supplement plan. With a cost plan, you can usually go anywhere Medicare is accepted, like a supplement. They may or may not have the drug plan included in their plan. If your drug plan is separate, you can change your medical plan every month. They have copays, they give you your max out of pocket limit, and they can include dental, gym, hearing, vision. This plan can change from year to year. And again, cost plans are getting phased out and are only offered in a select few counties in Minnesota. Now that we have learned all about the different parts of Medicare and the plans, when does it all start? Well, you can have your Medicare begin the first day of your birth month. It doesn't matter if your birthday is on the 3rd, the 12th, or the 24th. It'll always start the first day of your birth month, or 2 years after your disability. There is an exception if your birthday does fall on the first day of the month. If your birthday falls on the first day of the month, you get to start the month prior. But you may also delay Medicare as long as you have credible coverage. Applying for your Medicare Part A and B is the first step of the process. But when and how do you apply? Well, if you are receiving a Social Security check 4 months before you turn 65, Social Security will automatically enroll you in Parts A and B. If you are choosing to delay Part B due to having different credible coverage, you will want to inform Social Security. If you are not receiving a Social Security check and you would like your Medicare Parts A and B to start at age 65, you are in what's called your initial enrollment period. Your initial enrollment period is a 7-month window. It's 3 months before your 65th birth month, your birth month, and 3 months after your 65th birth month. If you are wanting your plan to start the first day of your birth month, I always recommend starting the process as soon as possible because it can take Social Security 30 to 60 days to process the application. So, for example, if your birthday is in March, you can start the process as early as December. Your Medicare Part B premium does come out of your Social Security check. So, if you are not collecting a Social Security check when you start your Medicare Part B, Social Security will bill you quarterly for that Part B premium. If you or your spouse is planning on working past 65 and plan on delaying Medicare Part B, you will want to ensure that you have credible coverage. Usually, the rule of thumb of credible coverage is as long as your employer has over 20 employees and is a group covered defined by the IRS. You will want to also make sure it has a credible drug plan as well. There is no penalty for delaying as long as it's credible coverage. Some people, however, do apply for Medicare Part A only at age 65. Once Medicare Part A is $0 and it will put you in the Medicare system. So down the line when you do apply for Part B, it may be a smoother process. If you are wanting to apply for Medicare Part A and B or just B past the age of 65, there is a special form that will need to be filled out to prove that you've had credible coverage. You can get this form through the Social Security office, or you may reach out to me and I would be more than happy to email it to you or give it to you in person. You can submit this form up to 3 months prior to when you want your Medicare to start. Again, I suggest starting this process sooner rather than later because it can take up to 30 to 60 days for Medicare to process the paperwork. You would be in what's called your special enrollment period, which is 63 days after you plan on retiring or losing credible coverage. Sometimes when you work past the age of 65, we suggest coming in for a no-cost consultation to see if Medicare could be a cheaper option over your employer plan. About 50% of the time, Medicare can be a cheaper option than your employer plan, so you can keep working but just have Medicare as your health insurance coverage. If you are someone who is getting TRICARE, CHAM VA, or retiree coverage, usually Medicare would become your primary. If you are someone who has a sharing plan or a traditional individual or family insurance plan like MNsure, for example, they usually will terminate you at age 65. And if you were on COBRA coverage, which is coverage offered by an employer after you retire, generally COBRA coverage is not credible. And the reason for that is when you fill out that form to prove that you've had credible coverage, your employer will need to fill that out. And the question on that form, it says, when did the employee work for your company? It does not ask if you continued their health insurance plan. Therefore, usually COBRA coverage is not credible and you could get penalties. So I just suggest talking to your advisor in that scenario. But generally, the rule of thumb, COBRA coverage is not credible past the age of 65. If you are someone who has a high deductible health savings account, or also known as an HSA, you may want to delay Medicare until you retire. But I would also suggest stop contributing to your HSA about 6 months before going on to Medicare, just because it could have some tax penalties. How do you choose which plan is right for you? You will want to look at your networks and decide which doctors and clinics and hospitals you would need. And for your drugs, you will want to make sure your drugs are in your drug plan formulary. You would also want to look at your portability. How often do you travel? When you do travel, how long are the durations of your stay? Do you need access to out-of-state doctors for routine visits while traveling? Also, you are going to want to look at your cost. What is your budget? Are you willing to pay a higher premium for a lower copay, or do you want to pay a lower premium for higher copays? This is something a licensed Medicare broker can help you navigate. So let's review. Your first step would be to meet with a trusted advisor to discuss all your options and to set up a game plan. Meeting with a trusted advisor does not cost anything, and they will help you navigate through all the plan options. Step 2 would be to signing up for your A and B. And again, if you are already collecting a Social Security check 4 months before you turn 65, they will automatically sign you up for Medicare Parts A and B. If you are wanting to start your Medicare A and B when you turn 65, you can do so by applying at ssa.gov or your local Social Security office. If you are wanting to sign up after the age of 65, you will need a special form to prove that you've had credible coverage that your employer would need to fill out. And then you would take that form to either your local Social Security office, mail it in, fax it in, or upload it at ssa.gov. And sometimes your trusted advisor can help you with this process as well. Step 3 in getting your Medicare Part A and B card. It will come in a discreet envelope, so make sure you are not throwing it away. And the final step is to sign up for your plan, whether it's your Advantage plan, a supplement plan with a drug plan, or a cost plan, with your trusted Medicare advisor. After you are enrolled, every year there will be an annual enrollment period. This runs from October 15th through December 7th. This allows you to change your coverage every year if you wish. I personally send out a letter to all my clients telling them that we are approaching annual enrollment, and if they wish to give me a call and set up a time to meet to review with their plan, to please do so. There is an additional enrollment period for people who are on Advantage plans, and it is from January 1st through March 31st. So if you are on an Advantage plan and you would like to switch to a different Advantage plan at this time, you are able to do so. I always say suitability is key. Take into consideration your health, your lifestyle, your desired benefits, your pharmacy, your networks, and cost when choosing the plan that's right for you. And I always love to give this example because I hear it almost every day. I hear, well, my friend Susie has this plan and I want that plan too. Well, that is great for Susie, but does Susie have the same income as you? Does Susie have the same doctors as you? Does Susie travel as much as you do? There are so many different aspects that go into picking what plan is right for you, and there is no one plan that is perfect for everyone. Another thing that I hear all the time as well is, well, what do most people do? Do most people do Advantage or do most people do Supplement? Well, this is a picture that was taken off Medicare.gov. They say about 25 million Americans have a Medicare Advantage plan, and about 22 million Americans have a supplement plan. So it's pretty 50-50, and there's no wrong answer in which plan you decide to go with. Now we're going to jump into Medicare's frequently asked questions and mistakes. So where should you get your shingles, tetanus, diphtheria, and pertussis and other vaccines? And those are at the pharmacy. Generally, drug companies are contracted with pharmacies, and your drug plan is what covers your vaccines. An annual physical versus a wellness visit, and which plan gives them. An Advantage plan would give you your annual physical. A supplement would give you a wellness visit. And I always get asked, well, what's the difference? Well, a wellness visit is generally just a questionnaire. Like, is there rugs to trip on at home? Do you feel safe at home? Can I keep my doctor if I enroll in Medicare? And the answer is yes, as long as they accept Medicare and or are in network with your plan. I am taking drug prescriptions. What should I do? You are going to want to find a drug plan that has your drugs in the formulary. And again, this is something that your Medicare broker can help you navigate. Will I have a Medicare coverage during international or domestic travels? And it depends on the plan. If that's something that you are passionate about, then just express that to your broker and they can help you navigate towards the plans that give you more travel coverage. Should I pick a plan based on dental and vision or how it's going to cover a heart attack and stroke? And I always say heart attack and stroke. There are some plans out there that like to offer extra bells and whistles, but then if you look how it covers major things, it might not be so good. So just making sure that you're considering your options very carefully. Which plans change each year? That would be your Advantage plan, your cost plan, which is a unique type of Advantage plan, and your drug plans. Those are the ones you definitely would want to review every year during open enrollment with your advisor. Which plans offers low premiums but require copays as you use the plan? And that would be Advantage plans. And which plans offer high premiums but the most comprehensive coverage? And that would be your supplements. Which plans have networks and which do not? So your Advantage plans would have networks and your supplement and cost plans would have no network. You would just want to make sure that they accept Medicare. Is there one company that is best for everyone? And the answer is no. So what do you do next? Your initial Medicare option should be considered carefully. The key is your needs, your lifestyle, your health, and many other aspects that go into providing the right advice to guide your decision. Educate yourself, meet with a trusted advisor. We do work with all the top insurance carriers in and around the area, and we do have an unbiased opinion, and we would be more than happy to help you navigate your plan options. And please make sure you are doing any Medicare research at trusted sources. Every state has different Medicare rules and regulations, and here are some sites that I would recommend doing some research at. And again, I am Rebecca Buck, and I want to thank you for watching my video. And if you have any questions, please feel free to call, text, or email me. We have 2 office locations, one in Rochester, Minnesota, and one in West St. Paul, Minnesota. We have an excellent team, and we are always willing to help in any way we can. I hope you have a great day.